Too many patients, a lot of them complaining, why am I late? You don't treat me right.
There's a lot of people coming there. The doctor is not that many.
So I think we have quite a shortage of doctor now.
Actually, a lot of them burning out.
其实现在很多马来西亚的人，他们对他们的政府医院有很多不理解的事情。比如说等待的时间很长，流程非常的复杂，当然还有一些他们不能理解的部分。但是其实在这个背后有很多我们不了解的事情。今天我找到一位在马来西亚当地的政府医院工作的医生，他叫 Leonardo， 我们暂且称他为小李子。我们会用一个比较轻松的方式来和他聊一聊关于这里政府医院的一些大家关心但不一定真的了解的事情。Could you briefly introduce your role and how long you have been working in a government hospital?
Okay, my name is Leonardo and I'm working as a medical assistant. So medical assistant is not well-known profession because it is only in Malaysia. It is like paramedics, the same level as the nurse, and quick history lah. In 17th century, during the British colonization, we are known as the one who give medication, the apothecaries, all are also known as the wound cleaner. But after the independence, then we were known as the hospital assistant, and in 1985, finally we get a license for the name of medical assistant.
So you have to do the test, or how do you get the license?
Yeah, we need to be in training for 3 years. 1.5 year, you'll be in the classes, and 1.5 year, you'll be put in various departments to learn become apprentice in various sectors like the clinics, surgeon, orthopedics, emergency department, and a lot of other departments in the hospital.
这个听起来就很像中国的研究生的那个规培。On average, how many patients do you see in a typical day?
In a typical day, depends. Right now, I'm working at the Klinik Kesihatan Sultan Ismail. I'll be working at the fever counter.
Well, it must be the most busiest department.
Probably blood taking.
Okay.
Yeah, okay, around 200 to 300 patients.
200
to 300
to 300 one day.
Yeah.
Wow.
Two or three staff doing that.
Wow.
Taking blood.
From my own experience, long waiting times are actually not unique to Malaysia. For example, in China, especially in large public hospitals, patients often have to arrive even before the hospital opens. In the past, before the mobile appointment system were common, we had to go earlier in the morning to queue for registration, wait for the clinic to open, and then wait again to see the doctor. By the time we saw the doctor, got the test forms, and completed things like blood tests, it could already take up half a day. If the test were quick, results might come out in the afternoon. But for slower tests, we could have to come back a few days later, register again, wait again just to review the results. Even now with mobile booking systems, the actual waiting time doesn't always match the appointment time. So I'm curious, compared to your experience here in Malaysia, would you say the waiting time is generally shorter or quite similar?
Well, I have not been in another place except Malaysia.
Yeah.
So it actually depends on the settings because the government subsidizes it very heavily. So the demand for it very, very high. Everyone wants to get this for free.
Yeah. They have to pay 1 ringgit, right?
Yeah, 1 ringgit. But if you're an elderly person or if you're working at the government, you're free.
Okay.
Getting it for free.
Okay. So if I want to go to a medical checkup at your clinic,
yeah,
I get there at about 8 a.m. What time can I get out?
I think it depends on what type of disease do you have. For the clinic, emergency, you need to wait longer if you're stable.
Do you have certain time, how many hours maybe?
But if depends on what the doctor orders for your blood test.
Okay.
If it's only for blood count,
On average?
Average 2 hours.
2 hours. Okay. 2 hours is okay.
For stable person.
Okay.
For unstable person, you need to monitor it first and probably refer it again to the hospital. So.
Many people feel that waiting time in public hospitals are very long. From your perspective, why does this happen? Not just because they can see the doctor for free. Do you have other reasons?
Yes. Well, there's a lot of people coming there. The doctor is not that many. Back in my states as Sarawak, there's only a few doctors available.
So it's less than West Malaysia?
It's more or less
okay.
West Malaysia.
Why do patients sometimes still have to wait even in the emergency department?
It's in my experience. So I was working at emergency in Cebu Hospital in 2023 to December 2023, 9 months. So patient needs to wait a long time. We crash at green zone, yellow zone, and red zone. At the green zone, there's only 1 or 2 doctors only available. So then a lot of people come there, but it's not emergency cases also.
And the doctor, do they have time to drink some water or go to the toilet?
Yeah, depends also. But I see a lot of them burn out also.
Oh, yeah.
At yellow zone, that were a lot of patients there.
Yeah.
Because
But the patients, they always say, I'm very painful and I can't wait so long. Why are you so slow?
Depends on the triage. If the triage look at your symptoms and they check your vital sign, it's already deteriorated your condition. They will bring you reason very immediately. They will treat you right away.
Yes. Do you often see cases where patients feel their condition is urgent, but medically it may not be classified as such?
Yes, a few times. There's patient that think the headache is very intense, but it's only viral fever or migraine, just migraine. But they're acting a lot like in pain.
Yeah. And they can't wait.
Yeah, someone with stomach pain, but only gastric.
Yeah.
Yesterday he drank so much, a few times.
Another thing I have heard quite often here is that some patients' family members fear that once their loved ones are admitted into hospital, they don't fully understand what is happening during the process. And this uncertainty can be quite stressful for them. So from your perspective, how transparent is the process in public hospital here? Do patients or their families usually have access to full medical records? And do doctors explain the diagnosis and the treatment clearly? For example, what medications are being used and why? In China, patients are often given printed medical records, including diagnosis and prescribed medications. So I'm curious how it works here in comparison.
Well, I think it's quite transparent here, but usually just write it down at the discharge note.
But they can't tell what they write down.
Sometimes depend on their handwriting.
Yeah.
Yeah, because we don't have someone who is totally in charge of that discharge notes. It's the doctor that works for the patient, and he works for a lot of patients that day, 10 to 20 patients. So handwriting probably not very good. I don't know.
Okay.
But still you can access the discharge note from the record unit at the hospital.
So if I want to know, for example, my family member get into the hospital and I want to ask the doctor what medicine he take, why he take this medicine, the doctor will have time to explain to me?
Yeah, usually they have time. But when you are discussing with the doctor, they have time.
No, okay. Are there situations where condition was already serious but not obvious to family members?
Yes, quite a lot. Actually, quite a lot. Someone they come with shortness of breath, but when I arrive at the hospital, it's already 75-80%. The condition is changed. We take ABG blood or acidosis, and we need to treat them right away.
Yeah. So, what is the most challenging part of your daily work?
Very well, yeah.
So many patients.
So many patients. A lot of them complaining. Why am I late? You don't treat me right. Yeah, you will become the first liner.
Yeah.
Look at the patient, what's going on right now.
Yeah.
Before they try to attack the doctor. That's one problem. And we want to treat the patient. Second, we want to treat the patient better. But time constraint and resource constraint us to do that, because a lot of other people need to waiting at the line.
Yeah.
So we need to deduce what is the most important for the patient and try to treat them as fast as possible.
Yeah. What do you think is the most common or unfair misunderstanding the public has about the government hospital?
The most unfair thing they say, because at the emergency, they think the doctors are not treating them well. Just when admitted to the yellow zone, they will be waiting for a long time there after given medication. Just a few medication, 1 or 2. So they wait for 3-4 hours there, and they think that the doctor not seeing them enough. So after 3-4 hours, I discharge them. I think that it should be shorter time.
Any conflicts between the patient and the doctor?
Yes, usually they have.
Because in China, some people, they take a knife or something, they just punch the doctor for waiting so long, or
taking a knife. Not. I haven't seen it, but trying to fight the doctor a few times. I will say. Yeah.
So, in your opinion, are there conditions that do not necessarily require a hospital visit?
Yes, I think for non-communicable disease like hypertension, diabetes mellitus, the hypercholesterol. Vegetable does not require hospitalization, and they just need to adjust their own lifestyle. And things like the mild headache, fever, flu, I don't think you need to go to hospital.
Yeah.
Just clinics, or if you don't want to it, just go to the pharmacy and ask for advice.
Yeah.
And that's faster way to go there.
But at the pharmacy, they have to pay more.
Yeah, a little bit more, but they did not need to wait, right?
Yeah. I have another question. Another observation from my side is that in China, public hospitals generally need to consider their operating costs and their performance-related expectations. In some cases, doctors' income can be linked to workload or service volume. So I'm curious, how does this compare to the public healthcare system in Malaysia? Would you say the system here focuses more on service or coverage rather than performance-based incentives? How are doctors usually evaluated in this setting?
I think like here in Malaysia, you work very long hours.
Yeah.
Sometimes they work 36 hours straight for the doctor.
Wow.
At the end of the day, their income for their based on their level still the same.
Same. No matter how many patients you do.
Yeah, no matter how many, just how many hours you work, they might pay you a bit lah, not much.
Okay. Wow.
So depending on the setting, if you're at the remote area, you'll be happy.
So
There's not
many
much patient.
government hospital doctors, they work for several years, they go out.
Yes, after the contract ends with the government, 5 years or 7 years, they usually go out because they are very demanded. Singapore, West Asia, and the Middle East, and Europe.
Yeah.
The Malaysian doctors are very high demand there. Same as the nurse also.
And this will cause the shortage of the government hospitals doctors.
Yes, for the early statistic this year, first intake, so we the government try to take one, so we make 6 intakes per year for the doctor. The first one I heard at the news, only 10% that fill the quota for the first intake this year. Only 500 doctor for the quota, one for 5,000. So even in that 500 people, many might not graduated as well.
Yeah.
Just finish housemanship and they can start build their own clinics.
I also knew a friend who studied medicine through a government-sponsored program because the medical education can be quite expensive. After graduating, she is required to serve in a government hospital for a number of years. So in a way, doctors themselves are also part of how the system sustains itself. So from your perspective, how would you describe the balance between the demand and the resources in the public healthcare system?
I think we have a shortage of doctors, especially in the West Malaysia.
Yeah.
There, my profession is medical assistant. A lot of us are in charge of the rural clinic Sarawak, and there's not much doctor, so only our paramedics that take care of the clinic. In terms of specialists, also not very much. And I also work at specialist clinic for 2 years, and I've seen the specialist clinic, they're also being covered by MO, not much specialist also at the specialist clinic. So I think we have quite a shortage of doctor now. I see a lot of them burning out.
Yeah.
Stress, when I assist them, sometimes like that.
Yeah.
We try to somehow control the environment. It's okay for now.
What would you like patients to keep in mind when they visit a public hospital?
Well, I think they should have patience.
Yeah.
One thing, have patience. And if they ask if they have medical friends, they should ask about the symptoms. If it's urgent or not. If it's chest pain, it's very urgent. Just go to hospital. If it's just headache or flu, you can handle it yourself. Go to clinic also, you need to wait.
Yeah. For the first interview, that's all.